In this video, we'll demonstrate Nysora's step-by-step teaching approach to performing a superficial cervical plexus block in a 27-year-old patient undergoing clavicle repair. We'll guide you through the sonoanatomy, technique, and practical tips to optimize safety and effectiveness, just as we teach it in our workshops and apps.
There you go. Good. Now, first step is position of the transducer right behind the sternocleidomastoid muscle. Do visualize the posterior border of the sternocleidomastoid muscle. That's the interscalene brachial plexus in the middle. We keep going up until we find the sternocleidomastoid muscle or the border of it. Okay, there it is. Yeah, just a little bit anterior here. There it is. Okay. So sometimes you clearly see the cervical plexus in the posterior border, sometimes you don't, and if you don't, you just insert the needle in that fascia. Okay, watch out, there you have a very large, you see IJ, okay, and the nerves are running right in front of it. Interscalene brachial plexus right there between the medial and anterior scalene muscle. That's the lateral or posterior edge of the sternocleidomastoid muscle. And in this fascia over here is where we are expecting to see the cervical plexus block emerging behind. If you go slightly proximal distal, you might be able to see them running in the fascia layer. Yeah, go slightly more proximal. Let's pop our needle into that space and inject about 2-3 milliliters of local anesthetic. That's all we need to do. Right here. You know, so exit the muscle, go above into the fascia. Yes, perfect. Let's see the needle tip right there. Perfect. Slack of pressure, aspiration. Now, you see, you're getting that twitch over here. And that's because you're already stimulating actually the superior trunk. That's good. There you go. Get outside. Yes, push, 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 push. Yeah, pull back now. Yes. Okay, so we were in the interscalene space. That's why. Don't move now. It's perfect distribution of the local anesthetic right there in that space. Push one more time. Yes, good. Great, that's done. Okay, so there was 3 cc's of local anesthetic. Now we need to do a PEC block. And for the PEC block, so let's visualize the PEC major and PEC minor. And we inject local anesthetic in the fascia between the two. Okay, so if you did this up here, that's actually your, like this, your best bet. This is gonna hurt, so we don't want to overdo it. There you go. Right there, so that's a fascia layer between PEC major, PEC minor, and those are lateral pectoral nerves. Go ahead. You can do outer plane, perhaps.
Thank you.
Can you see? Yeah. Keep going. Yes, almost there. I'll give you a little local anesthetic so you know where you're at. Pop in. Great. Pop in a bit more. Perfect. There you go. And slack of pressure a little bit. Aspiration negative. Separation between the 2 layers of the fascia of the PEC major, PEC minor. Yes. Okay. There you go. Great. So if we now just see this like this. Yeah, hold it. Show us the distribution of the local a little bit just for a movie. Sometimes it's tough to see, actually, but okay. We accomplished what we wanted to accomplish. There it is. Yeah. The local anesthetic is in between the fascia layers, but it's also on top and underneath as well.